Good morning everyone. Myself Dr. Geetanjli Chawla, Assistant Professor from the Faculty of Physiotherapy, RPIIT Campus, Karnal. Welcome to our YouTube channel, that is RPIIT Academics. Do not forget to hit the like and share button if you like the video. Do not forget to subscribe our channel and hit the bell icon. So today we are going to learn about goiter. So what is goiter? Goiter is the swelling in the thyroid gland and it is an endemic disease. For the classification, we can classify the goiter into simple goiter, which occurs diffusely or physiologically, or in pubertal age group, or in pregnancy. It can be of multinodular type. Then the second one is the toxic goiter, which is diffuse and happens in Graves' disease. It is also multinodular and it also involves the lymph nodes known as toxic adenoma. Non-toxic goiter is caused by the lithium or other autoimmune diseases. Other one is the paradoxical goiter. In this type of goiter, we have enlarged thyroid gland as a result of very high intakes of iodine. It occurs in Japan and China with high intake of seaweed, like approximately 50,000 to 80,000 milligrams per day. Other classifications are palpation, type 1 palpation struma, in which in normal pressure of head it cannot be seen, but it can be felt on palpation. Type 2 is the struma is palpative and can be easily seen. One can easily see the swelling also. Next one is the type 3, in which the struma is very big and is retrosternal, and pressure and compression marks the changes in the thyroid gland. If we talk about the incidence, daily iodine requirement is 0.1 to 0.15 milligram, and in endemic goiter it occurs in geographical areas with iodine depleted soils and usually in the regions which are away from the sea coast. It is common in Central Asia and Central Africa, central areas of Australia including Tasmania, and areas along the Great Dividing Range. In this picture you can see the areas which are marked as dark red shaded color. These are the regions where the soil is iron deficient, and one can evolve goiter very easily. If we talk about etiology, the major cause is the iodine deficiency, and countries that uses iodized salt, the Hashimoto's thyroiditis becomes the most common cause of the goiter. Hypothyroidism, like if one have congenital hypothyroidism, ingestion of goitrogens such as cassava, or any side effects of pharmacological therapy, one can have goiter. Hyperthyroidism, like in Graves' disease, thyroiditis in acute or chronic conditions, or thyroid cancer. If we talk about natural history, growth stimulation occurs and diffuse hyperplasia occurs. Now it can have two options, like active or inactive lobules. If one have active lobules, it will follow the path of vascular and hyperplasticity, and active follicles will generate. And if one has inactive lobules, it will go into necrosis and the inactive follicles would take place. Symptoms are, without any hormonal abnormalities, no symptoms will occur. Anterior neck mass will be palpable or can be seen in type 2 or type 3, stage 1 or stage 3. Large masses, compression of the local structures can also be seen, like the tracheal compression can be seen, and difficulty in breathing and swallowing can be the most disturbing symptom. Toxic goiters present with symptoms such as palpitations, hyperactivity, weight loss despite of increased appetite, and heat intolerance. Here you can see the tracheal compression caused by the swelling of the goiter. Thank you.